Good morning. My name is Ghislaine from Apricity. Represent the next generation fertility clinic. And I'm here today with Andrew Berkley, our Chief Operating Officer, founder of Apricity, who has a huge experience, 20 years experience in fertility. And we would like to offer a conversation to answer some of the most frequent asked questions about fertility. And we suggest we will do that in different parts. But perhaps, Andrew, can you please explain to us why fertility matters so much in the workplace?
Yeah, sure. Thanks, Ghislaine. Fertility in the workplace is a really large issue. A lot of people think that it's a niche topic. However, about 1 in 6 couples or women trying to conceive have difficulty. There are many, many different issues as well around fertility. It's not just couples. There are same-sex females, same-sex males, and also women wanting to delay their pregnancy until a little bit later in life. So it's not just the infertile couple that struggle to conceive. In terms of a definition of infertility, usually if couples are trying to conceive, they need to be trying to conceive for over 12 months before fertility treatment is recognized, unless they have a clear diagnosis.
But those numbers are huge, and very often people think it's a very niche problem. So what are the root causes of these huge numbers?
Well, the main one, Ghislaine, well, there are many factors, but the main one is women leaving it later in life to try to conceive or try to start a family. So we have seen the average age of the first mother in the UK at least increasing massively from around 23 years of age until 26 and 27 years of age. And that's natural pregnancy as well. So when we talk fertility, we often see patients coming to us who are mid-30s towards late 30s, and they feel that they now want to start trying to conceive. However, with women's age, fertility potential decreases, particularly over the age of 38 and even over the age of 40. The woman's fertility potential decreases.
Yeah, although we get that, the clock is ticking, we know that, but some women just have not found the right partner or would like to prioritize their career for some time. So what would you recommend to them, basically? Is there a solution there?
Absolutely. Fertility treatment is not just for patients wanting to conceive immediately. We have solutions such as social egg freezing, where a patient undergoes the very similar pathway towards IVF. We have a stimulation phase and then we collect eggs. But instead of going straight for an embryo transfer to help them conceive, we put their eggs on ice, so we freeze them. We're in the process at the moment of the UK as well of extending the storage period of frozen eggs to around 55 years. So women can actually keep their eggs in storage for up to 55 years. So social egg freezing is an increasing need for ladies who want to preserve their fertility potential and give themselves options for the future.
Yeah, thanks a lot. Because you said it also at the beginning, we're not talking only about infertility. For some people, choosing assisted reproduction treatment is a choice, and it's not linked with the fact that they are simply infertile. So can you elaborate a little bit on LGBT or solo mothers and in the UK?
Yeah, for sure. You're right, Ghislaine. The way we look at families now in the UK is very different to 20, 30 years ago. We have same-sex females coming forward for treatment who need a sperm donor to help them conceive. We have same-sex males coming forward for treatment who are looking for a surrogate host as well as an egg donor to help them conceive. And solo mothers as well are representing around 4% of the UK fertility treatment cycles at the moment and growing. So we're seeing a big increase in the number of LGBT community patients and also solo mothers wanting to have a child through fertility treatment.
So it's great. So So in short, what you are saying and sharing with us is to say that infertility is not a niche topic. We talk about 1 out of 6 individual or couple in the UK. You're saying that there is a growing number of people who need art, but also because they choose it, LGBTs or solo mothers. And you're also saying that there are solutions for women who are simply not ready to conceive early, and we would like to freeze the eggs. So very good news. And perhaps now we would like to move to a second set of questions. We very often hear that fertility treatments are very stressful, very painful. Can you a little bit elaborate on this, Andrew?
Sure. You're absolutely right, Ghislaine, that our patients going through fertility treatment are on an emotional roller coaster. They're on an emotional roller coaster in their own lives, either with a partner or alone. They feel quite unsupported throughout their journey. They may have a network of close friends and family to help them, but they need some medical help as well. The fertility journey was created 40 years ago. So IVF came about just over 40 years ago, and it really hasn't changed a great deal in terms of putting the patient at the center of what we do. So patients do feel like they're on a conveyor belt going through treatment. They feel all the emotional roller coaster, the ups and downs of their treatment throughout. There is hormonal stimulation, which also increases the emotional impact on a patient as well. And often the partners in the relationship along the journey are a little bit left by the side. So what we try to do with Apricity is make a bit of a difference there. We put the patient and the couple truly at the center of what we do, supporting them right the way through treatment.
Yeah, thanks a lot, because we hear so many difficulties. There is clearly room for change there, because what you describe is extremely painful. So what is the impact for the woman, for their couple, but also for their employer? Because I would imagine that the impact can be quite massive.
It can indeed. We've seen some recent studies of fertility treatment in the workplace, which say that stress is felt by about 88%. So a huge number of patients going through fertility treatment. So stress is a real key factor. A lot of patients also stop their treatment midway. So they actually give up on their fertility treatment and explore other options. Patients are feeling a loss of control for sure throughout their pathway. And also another one is about high price and being aware of the costs of fertility treatment as well along the way.
So we heard that it's a massive problem. We heard that it's very impactful and very difficult for women and for men to go through fertility treatment, very often for 18 months or more, and that impacts massively the business life. So we keep the best part for the end. So what are the solutions, Andrew, and how effective are fertility treatments?
Okay, so the solutions really, Ghislaine, to making this a better journey for patients and putting them at the center of what we do. The first area is about access to care. So to reduce absenteeism from for the employee from the workplace, we enable patients to have more care at home, in the comfort of their home or very close to their home. So they can have blood tests at home, virtual consultations with our doctors, nurses, counselors. They can have ultrasound scans throughout their cycle very close to their home or even their workplace. We're also looking at the fact that patients need to be supported. We talked about their emotional journey throughout, and we have a team of fertility advisors who are there to hold the patient's hand throughout the journey, coordinate all of their care, coordinate their appointments, and help empower the patient to make more informed decisions along the way, to be more in control of their own journey.
So yeah, that's very interesting, because what you're saying is that treatments are effective. We know roughly in 70% of cases, people get a baby in 3 cycles average, so it's really good. But what you're saying is that you have to be very careful because all the clinics do not deliver the same level of care, and supporting and helping people finding the best clinic is something probably important for corporates also to support their employees in this difficult journey.
Yeah, Ghislaine, I think when patients ask, how do I choose a fertility clinic that's right? I think the first question is to ask the patient, what do they want from their fertility journey? And most patients want a supportive team with one-to-one level of care from a close team of a doctor, nurse, counsellor, patient relationships and patient advisors. The second is that they want to actually access the care when they want to and where they want to, rather than being told to go to a fertility clinic 20 miles away 5 times in a week. And the third really is about the level of customized support and making sure that the patient is empowered along their own journey to make their own decisions. And the fourth, of course, is looking at the outcome. So patients will be choosing fertility clinics based on the clinic success rate. There are differences between the success rates of fertility clinics. And what we're doing with Apricity is trying to maximize patient chances, helping them reduce their stress level along the way, and giving them the right treatment options to enable them to have the best chance of success.
And although, just a question also, I would imagine that technology can be used differently depending on clinics. Is it also an important factor?
We think it is an important factor, and patients tell us that they like to know what's next, what the next step is, where to go, what dose of medication to be taking this evening at 9 p.m., for example. And what we've developed is an Apricity mobile app, which is the patient's companion in a way, so that they know exactly what to do, what's next, what's coming up. And it also gives them information and guidance, answering a lot of their questions through curated articles, videos, and the patient can also communicate with our fertility advisor throughout the process through a chat messaging functionality.
Okay, that's great. So technology can provide a greater protocol adherence, I would imagine, and a better information. So that's great news. But we talk about all that. We have not discussed about the prices. We often hear that it's extremely expensive. Can you elaborate on what is the price of such treatment and how to navigate in this very complex world?
Yeah, sure. If we talk about IVF as an example, the general price of IVF in the UK for one treatment cycle is about £6,500 to £7,000. However, when you look at traditional fertility clinics' website, it's slightly misleading. They tend to give you a headline figure of, let's say, £3,500, but they're not including everything in that £3,500 for the whole cycle. So the approach we've taken at Apricity is to make sure that we've packaged priced a treatment type, so let's say IVF, and we cover everything within that treatment from end to end at one fixed price for every single patient. This gives transparency to the employee if they're funding the cycle themselves, or to the employer who may be funding treatment as well on behalf of their employees. So again, no hidden surprises, no extra bill for extra medication that comes midway through the cycle, and enabling patients and employers to make the right decisions and choose the right partner clinic for them.
Oh, so that's perfect. So also an important criteria, obviously, both for the employees, but also for the employers. So we're coming now to employers, and we know that in the US, a lot of companies are covering fertility for their employees. It's now coming to the UK. It's still pretty recent, but can you explain to us how it works for a corporate when they want to support their employees?
Yeah, sure. So we have a number of large corporate clients who fund treatment for their employees. Some corporate clients would like to fund the full treatment, meaning up to 3 cycles of IVF treatment for their employee. And how it works with Apricity is that we have contract pricing for each of the cycles, so the employer knows exactly how much each cycle will be costing, and we actually liaise with the employer through their insurance provider to make sure that the invoicing is handled without the employee being stuck in the middle.
So what we are saying is that it's included in the PMI with a trust mechanism, and you ensure a full confidentiality for the employee, so that they are completely relaxed on the type of questions and discussions they want to have with a fertility clinic.
Absolutely, and we're seeing as well a large number of corporates in the UK wanting to adopt fertility into their health cover for their employees. We know from a Willis Towers Watson report recently that 1 in 4 corporate employers are looking to fund fertility over the course of the next 12 months.
Yeah, and I read that even in some sectors where companies have probably more difficulties to recruit talents and retain them, it can go up to 40% of those companies want to cover fertility in the coming years. So yeah, between 25 and 40, which is huge. And it clearly shows that a lot of corporates have identified that this is a main root cause of stress on the workplace, and they want to support their employees the best they can in this difficult journey. So that's great. We often talk about very large corporates. Are we talking only about large corporates or also about SMEs sometimes?
Yeah, Ghislaine, we're also talking about SMEs too. We have different models and different modes of contracting with different employers. So absolutely, this is fertility benefits in the workplace is not only for large corporates. We can apply it to SMEs in slightly different ways too.
Oh, so that's great. So what we are saying here is that for a corporate, it seems to represent a relatively minimal cost, because we said we talk about 1% or so of the population going through an IVF per year. But a corporate who would support their employees would reduce massively stress, absenteeism, resignation, and they would show more support and more care. And what you said also, which is very important in conclusion, is that it's extremely important to choose the right partner clinic. Not all clinics deliver the same level of care with what employees need, which is basically information, guidance, education and guidance, great success rates, reduced stress, and of course, better compatibility with a professional life. So thank you very much, Andrew, for your time. And I hope this conversation provides a lot of answers to the questions we very often ask. If you have more questions, you will see our contact details and you can get in touch with us directly, of course.